Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience working in mother, baby, postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm perinatal mental health certified and maternal newborn nursing certified. Having a cesarean section delivery can be very scary. Today we're going to explain everything you need to know about the type of cesarean section delivery you might have, as well as the incision, what it might look like. So click those like and subscribe buttons and stay with us. All right, so our first type of C-section is a scheduled C-section. This really is the most common. These are C-sections that happen for a variety of reasons. It could be that you're having a repeat C-section, meaning that you had one before. You might have a sexually transmitted disease that prevents you from having a vaginal birth because it puts your baby at risk, like active herpes lesions. Also, certain medical conditions like blood pressure issues might make it better for you to have a cesarean section. Now, these deliveries happen at 39 weeks or afterwards. They're usually scheduled in advance, sometimes 2 or 3 months in advance. The nice thing is there's a lot of hospital coordinators that help with this process. And if for some reason you are expecting to have a scheduled C-section for a preterm baby, you can do stuff like tour the neonatal intensive care unit and arrange for help at home before your delivery. Unplanned C-sections are very, very common when it comes to C-sections. Most of the time, your friends and your family are going to say they had an emergency C-section, but what they actually had was an unplanned C-section. So unplanned C-sections happen if your labor slows down and you're not dilating anymore. This can also happen for something called pelvic disproportion. This means that your pelvis isn't big enough to allow the baby to come down. This can also happen for a breech baby. Sometimes, even though leading up to your delivery, the baby looks in the right position, but then the day you come in, your baby is now butt down, head up. This is a C-section. If your baby's heart rate drops during the labor, or if the baby has meconium, which is poop inside the amniotic fluid, we may decide to go ahead with a C-section. And finally, if you have prolonged rupture of membranes, this means that your water broke for over 12 to 24 hours, or if you're developing an infection, we may do an unplanned C-section. Our final type of C-section is an emergency. And believe it or not, emergencies can be divided into 2 different types: urgent and emergent. So urgent C-sections are C-sections that we have a little bit of time to get things together. So if you haven't had, say, a steroid shot and they want that for you because you're a preterm birth, they may wait an hour or 2, even though we've decided that we're going to give you the medication. However, the true emergency sections, those we just go. It's go, go, go. You'll see a lot of people in your room, and those can be very scary. But just understand, everybody's there to help you and your baby, and they will answer your questions even as they're rushing to get you to an operating room. Some of the reasons why you might have an emergency C-section include a cord prolapse, which is where the umbilical cord comes in front of your baby's head, a shoulder dystocia, which is where the baby's shoulder gets stuck inside the pelvis, if you have a seizure, if you have a uterine rupture, this is where the uterus opens up spontaneously, if you're hemorrhaging or bleeding out, or if you have a placental abruption, which is where the placenta detaches from the uterine wall. Please remember to hit the like and subscribe buttons so you can get our latest content. Now let's talk about incisions. Incisions are the surgical cut that happens during the surgery in order to get your baby out. The most common incision is called low transverse. This is what everybody kind of expects. It's also called the bikini cut, and that's because it's a small horizontal incision in your lower abdomen, approximately 6 inches long. The idea is that it's so low you can hide it with a bikini bathing suit. It actually is the ideal view for your provider to get your baby out. There's less bleeding with a low transverse incision. It also provides a strong scar that heals well on your uterus. Finally, this incision has the least amount of pain associated with it, and this gives you the chance to have a VBAC delivery, which is also known as a vaginal birth after cesarean section. A low vertical incision is the next option. So this is similar to low transverse, but low transverse is horizontal and a low vertical is up and down. This is a good option if your baby is feet first, bottom first, or sideways in your belly. But to be very honest, this incision is rarely used. Our final C-section incision is the high vertical. This is also known as traditional or classical. This is the same as that low vertical, except it goes higher on your belly. Frankly, it goes from the bottom to your belly button. This is the best incision for preterm babies. It can also be used if the baby is positioned sideways or for an emergency cesarean section delivery. However, we try not to use this because this incision is associated with a lot of complications, including increased pain. It can also be associated with an abdominal hernia, which is the separation of the abdominal wall, infection, and elimination of the ability for you to ever have a vaginal birth. You may be wondering, how does your provider decide what incision to use? So a couple things you need to know is you may have that low transverse or bikini cut incision on the outside, and there may actually be a different incision on the inside. So this is something that you want to ask your healthcare provider. The decision is based on whether this is a planned C-section or an emergency C-section. Additionally, your provider is going to look to see, do you have other surgical incisions or scar tissue inside? It also makes a difference the size and position of your baby, as well as the size and position of your placenta. I hope this video has helped you learn what to expect when you have your cesarean section delivery. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor and delivery, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.